All right, good evening, everyone. We'll go ahead and get started for the sake of time. My name is Saad Howard. I just wanted to welcome you all to our Salisbury VA Healthcare Systems Choose VA Tele-Town Hall. We're very excited to have you guys here to learn a little bit more about VA healthcare. Today's event is designed specifically for veterans who are not currently enrolled in VA healthcare. So we have 30 minutes allotted this evening where we'll talk about what VA offers as far as healthcare, address some of the common questions about eligibility, enrollment, just to make sure that if you are interested in VA healthcare, that you have all the tools that you need to move forward with your enrollment. We also want to hear from you. So we have a slide deck prepared to kind of go through some of the talking points I just mentioned, but we also will have time at the end to answer any questions you have about our programs, eligibility and enrollment processes, pretty much anything that is on top of mind regarding this topic, we'll be happy to answer. So I believe the chat and the Q&A functionality is enabled for tonight. So feel free to drop your questions in the chat or either the Q&A, and we'll be sure to get to them when we get to the Q&A portion of tonight's presentation. So our goal is really for you to leave tonight with the information you need to determine if VA healthcare is right for you, and if so, how to take those next steps. So with that, we'll get started with today's program. It is my pleasure to introduce our Acting Executive Director of the Salisbury VA Healthcare System, Mr. Dave Collins. So he'll start us off. So Mr. Collins, I'll turn it over to you.
Hey, thanks, Todd. Appreciate it. Hey, good evening, everybody, and thank you for joining for tonight's Choose VA Tele-Town Hall. I'm Dave Collins, Acting Executive Director for the Salisbury VA Healthcare System, and it is a privilege to welcome you. Tonight is specifically for veterans who are not currently enrolled in VA healthcare. Our goal is simple: make sure you understand what may be available to you and how easy it is to take the next step. If you served our country, as I did, we want you to know that VA healthcare is worth exploring. You do not have to have served in combat, and you do not have to give up private insurance simply because you enroll in VA care. VA offers comprehensive care designed specifically around veterans, from routine primary care and specialty care to mental health, prescriptions, urgent care, virtual care, and much more. And even if you do not need VA healthcare today, enrolling can give you another option for your healthcare needs in the future. Tonight, our team will walk you through the benefits of VA healthcare, address some common misconceptions about eligibility, explain how to apply, and answer your questions. And most importantly, we want you to leave tonight knowing where to go and who to call to get started. Now, before we get into eligibility and enrollment, I want to briefly show you what VA healthcare looks like right here in our local community. Some of our local facility information. The Salisbury VA healthcare system serves veterans across our region through several locations, so accessing VA care does not necessarily mean traveling to Salisbury. Our main campus is the W.G. Bill Hefner VA Medical Center in Salisbury. We also provide care through the Kernersville Healthcare Center, the South Charlotte Healthcare Center, and North Carolina community-based outpatient clinic. Across these locations, over 105,000 veterans have access to a broad network of services and providers focused specifically on veteran care. Whether you live closer to Salisbury, Kernersville, or Charlotte, our goal is to connect you with the right care at the right location. VA care can also extend beyond our facilities through options such as virtual care, urgent care, and community care when eligibility requirements are met. So if distance or convenience has been one of the reasons you have not considered VA before, I encourage you to take another look. As I said earlier, we are currently servicing and caring for over 105,000 veterans over a 21 county area. And we would want you, if you see fit, to join our VA healthcare system. Now that you know where we are, I'm going to turn you over to Miss Shanae Knox, our Supervisor of Enrollment and Eligibility, who will walk you through what VA healthcare can offer, who may qualify, and exactly how to get started. Ms. Knox, will you take it away?
All right, good afternoon, everyone. So some myths versus facts about enrollment. A myth is I didn't serve in combat, I wasn't injured, so I'm not eligible for VA healthcare. Well, the fact is, if you served in the military, even during peacetime, and separated under any conditions other than dishonorable, you may qualify for VA healthcare. Another myth is I don't want to go to the VA because I want to save those appointments for those who really need them. And the fact is, we receive funding based on the number of veterans who use our services. By choosing VA for your care, you're not taking away from others. You're helping expand access for every veteran. Another myth is I want to go to the VA, but I do not want to lose my private health insurance. The fact is, assuming you are eligible for VA health care, you do not need to give up your private health insurance. You can keep your private insurance and VA health care too. The best of both worlds. All right. A couple more myths would be I make too much money, so I have never applied for VA care. The fact is, eligibility isn't just about income. There are many other factors taken into consideration when applying for VA healthcare, including service-related conditions, time and location of service, and more. Another myth would be I have a service-connected rating or disability rating through the VA, so I'm already enrolled in VA healthcare. The fact for that would be disability benefits don't automatically enroll you. You must still apply for VA healthcare. The good news is that a service-connected disability is a qualifying eligibility factor. So choosing the VA means you get everything you need in one spot. VA comprehensive health care services can improve your health and well-being while saving you thousands of dollars per year. Even if you don't need this care today, you may need it tomorrow or the next day or 20 years from now. And once you're in, you have access for life. The only thing is you just always have to do a means test update.
What could VA healthcare mean for you? Comprehensive healthcare, from preventive to specialty care, no insurance needed. What your provider recommends is what you get. Vision and hearing care, exams, glasses, contacts, and hearing aids for eligible veterans. Mental and whole health, support for your mind and overall well-being. You all could have urgent care access, 3,000 plus locations nationwide, virtual visits to see a VA provider from home, prescriptions made simple, filled at visits or mailed to you with easy refill options, VA health and benefits app, schedule appointments, refill prescriptions, and manage benefits online. Travel reimbursement. Eligible veterans get paid for miles and from scheduled appointments. Easy check-in, No forms, just your VA ID. Community care, be seen in your community if the VA care is too far or not available. Dental care, available for those who qualify. Learn if you're eligible for VA care. Your service matters. So does your health. If you served in active duty, active military or reserves or National Guard, called to active duty by federal order and completed services, even during peacetime, you may qualify for VA care. What you need to enroll. To get started in healthcare benefits, you'll need the application ready, which is the 1010EZ, your discharge papers, your DD-214 or DD-215, your most recent tax return, and your social security numbers for you and your dependents, insurance cards, and details.
Okay, so some different ways that you can enroll is you can apply online at va.gov. You can apply by phone through our Health Eligibility Center, which you will hear people call that HEC. And that number is 877-222-8387. You also can apply in person at the Salisbury VA, which is the WG Bill Hefner, Kernersville HCC, or South Charlotte HCC. As you see on here, the eligibility departments, the floor that they're located on in the buildings. Also, you can apply by mail. You can send it to the Health Eligibility Center in Janesville, but you also can mail it to Salisbury, which is a WG Bill Hefner, Kernersville HCC, and South Charlotte HCC. And you would just put attention eligibility department, and it will come to us. And so after you apply, you'll be notified within a week. If you come in person and apply, you'll find out same day. But you'll get a welcome call to schedule your first appointment and ask questions. No waiting or wondering. You'll get a confirmation letter with details on the next step. You also will get a VA benefits handbook, and it'll explain your coverage, copays, and priority groups. All right. So now we're at our questions part of it. And if anyone have any questions, we're here to answer them.
Hey, and Shanae, thank you. And we want to make sure tonight's useful to everyone. So now we want to hear directly from our veterans. We have time set aside for your questions about VA healthcare, eligibility, enrollment, assessing care, or anything you heard during tonight's presentation. There is no wrong question. If something has kept you from applying or you are simply unsure where to start, this is your opportunity to ask. And if we cannot fully answer a specific question tonight, we'll make sure that we connect with you with the appropriate resources. And I really like one part of Shanae's briefing. You know, I've encountered quite a few veterans who never came to the VA for whatever reason. They had health care with their employer or whatever, but as they got older and their insurance or whatever may have went away, or the company went away, they came in and they went in, checked in eligibility, and what do you know, they qualified. So I see plenty of great questions here. Kevin, I don't know if you or Saad are going to read those to Shanae or how we're going to do that, but I'll punt to you all, okay?
Thank you, sir. All right, ladies and gentlemen, good evening again. My name is Kevin Stapleton. I'm the Chief Communications Officer here at the Salisbury VA. I'll just go down the list for our questions, and I think Ms. Shanae is going to hit most of these. We're going to start with those submitted to the Q&A tab, and we'll pivot to the chat shortly thereafter. This first question reads from Jess Gilly, what if I go on Medicare with no private insurance?
Okay, so can you repeat that again for me, Kevin? I'm sorry.
Yep, no problem. The question reads, what if I go on Medicare and I do not have private insurance?
Oh, well, that's okay because they still can apply to enroll. It won't affect anything. You don't need private insurance to enroll.
All right, and the next question here from Roulette DeBose. What if you only served 2 years but got out under honorable conditions?
Then you are eligible to apply.
Next question here from Brenda for Steve. My husband has been told that he does not qualify because he served between Korea and Vietnam.
Okay, so yeah, he would need to just reapply or just call up here to us. I can give my direct extension to speak with them because that would be one that I would need to look into. But those two locations are actually a part of our terror right now. So he would need to reapply.
All right, next question from Kim. I have TRICARE and I turn 65 next year and will have TRICARE for life along with Medicare. How does VA benefits work with both TRICARE and Medicare?
So they would still be eligible to enroll. It wouldn't impact them at all, like not in a negative way at all.
All right, we're going to go to the chat now here. First question, I think we already hit the TRICARE one. Do you need an appointment to apply in person, particularly at the Charlotte locations?
No, you do not. You can walk in person Monday through Friday, 8 a.m. to 4:30 p.m.
Here's a question from Sarah. Good evening. I'm Sarah from Accessible Home Care of Greater Charlotte. We provide care for veterans. What is the best way to connect with veterans that need care but aren't aware they are eligible for hours of care? Sarah, we'll pass our contact info to you through the chat, through email. We can get you the right point of contact to expand further on that on a separate forum. Thank you. Another question here from Russell Clark. Is there an income cutoff and why is my tax return needed?
There is an income cutoff. Not necessarily your tax return is needed. If you work and you know the amount of money that you've made or amount of monies that you've made for the previous year, we can most definitely calculate those monies up. It's just easier to go off your tax return so that there's no way that if you report, say for instance, you made $60,000, but you only report 45,000. If we use your tax return, there's no way that you can come up and be audited later on in the system.
Next question here from Todd. What if I cannot find my DD-214?
If you can't find your DD-214, we have multiple systems available where we can go in and try to search your information. And if we're able to find your information, then we can get you registered with the most multiple systems that we use. I'm sorry, I got tongue-tied. If we can't, then we would have to ask you to request your DD-214 through the National Archives.
All right, next question. This is a request to provide the eligibility website again. I believe we have that on the slide deck on the screen right now. Next question here from Jerry. If I qualify, does that mean my spouse is eligible to receive benefits too? She is also a vet, but no disability rating.
If you qualify with your spouse and you don't have a disability rating, your spouse can also apply to see if she qualifies as well.
Next question from Reggie. I applied online previously, but believe I'm in group 8. Am I available for any VA healthcare services?
So for that one, we would need his information to look him up to see what Group 8 is, because there are different options of Group 8. So if he doesn't mind, if he could provide us his information, then we would look him up and we can give him a call tomorrow.
Next question from Ed. What is the list of documents needed to bring in for the application?
The application, DD-214, income from the previous year, social security numbers for yourself and any minor dependent children that you may have, your spouse information as well if you are married.
Next question from Ms. Sherry Byers. I was in during peacetime and now retired. I have my own insurance, but wonder if my bills will still be paid by the VA and any residual expenses absorb the residual. Also, I've lost my DD-214, but have other paperwork indicated by my honorable discharge. Do I need the DD-214?
So we have multiple systems, so we can go look in the system to see if we have any military dates for you. There are certain documents that we can use to identify that, but we would look through our system first to see if we have your military time, and if we do, then no, you do not need your DD-214.
Next question from Hill. Can I have Medicare and VA at the same time?
Yes.
Yes.
Next question from Larry. Does Social Security income count towards your income cutoff amount?
Yes. As long as it's not disability, but just Social Security by itself, yes, it does count.
Next question from Lee Gallion. What if I am on an SSDI, have Medicare, but I need dental care? I am married and we filed jointly. What income is considered the household income or just my individual income?
So no, you would still need both incomes. I can tell you what the cutoff would be for that, but so the cutoff for that would be 52,000 for the income for the household. But as far as dental care, you would have to have a service connected disability percentage to even be eligible for that.
Next question from Quincy. May a non-vet spouse be included?
Included in.
Quincy, if you want to elaborate further in the chat, please, we'll return back to you as soon as possible here. Next question from Joe. What is the income cutoff range? I think you might have already hit that, Sinead, but you want to reiterate one more time?
I will, but so with the income cutoff, it just depends on how many dependents you have or if you don't have any at all. So that question right there is kind of a wide range. But if you are by yourself, it would be 43,335. But if you have dependents, then that number increases. So that would be a question that if you would like to give us a call, we can kind of go over that as well.
Next from Ms. Sherry Byers. Does the VA pay the residual expenses if you have medical insurance?
No, we do not.
Next from Jerry with a 50% disability rating. Does that mean income is moot?
So you wouldn't have to report your income.
All right, we're going to pass it back over to the Q&A tab. I'm not seeing anything else in the chat. Let's see here. First question here in the Q&A tab from Roulette again. So are you saying if you make too much, we do not qualify?
Yes, but there's certain factors to determine that. You can make too much money, but you can have non-reimbursement expenses that you had to pay out of pocket for the previous year. There are other, you could also be in an area where it's called where the 7C group come in at, and it's just geographic location, and sometimes you can qualify that way.
And Kevin, if I can interject real quick, good evening, everybody. My name is Ken Green, the Chief of Health Administration at the Salisbury VA. I just wanted to put kind of a little bit of a finer point on what Ms. Knox was saying. And Sinead, y'all just indicated that was not Can you guys hear me?
Yes.
Now we can.
Okay, I think I'm cut out here. And Shanae, can you repeat the answer that you had right there? Because I wanted to touch on that, but I think I was cutting out and don't know. I heard all of what you said. And there was an important point to that. I think the special eligibility categories,
Yes.
and that's something everybody needs to be aware of. Income is very important as far as how Congress has set up the benefits in VHA. But there are numerous special eligibility categories that could make you eligible regardless of your income status. So I would encourage you to, even if you make over the threshold, I would encourage you to apply anyway, because you may unknowingly qualify under one of those special eligibility categories, and you would be eligible, through that mechanism instead of having to worry about income. So it's income's important, but it's not everything.
Right. That's correct.
All right, thank you, Mr. Green. Next question here from Roulette. I live in Atlanta, Georgia. Where would I go for VA healthcare? Looks like Roulette, there was a response provided there to locate under the Atlanta VAMC your local VA clinic near your residence. So feel free to click that link when you have time. From Kim, this next question reads, what if I have a service-related injury, but the U.S. Air Force lost my medical records for the time frame in question?
So are they saying that they are service connected already?
They don't specify, unfortunately. I think they're just related. They're just indicating they have an injury from their active duty service, but they don't have the medical records supporting it.
So they can still apply if they would like to enroll. That doesn't stop them from enrolling.
Yeah, and I think they can also file for disability as well through VBA, and they can get supporting statements from people that they served with in lieu of medical documentation. Isn't that right, Shanae?
Yes.
Yeah, so that's another way to go about it. If you don't have the actual medical documentation, you can, there are other options. And I would just recommend that you call one of our health benefits advisors and have them talk you through that and try to, coach you on what to look for and what to go out and gather in support of any claim that you might want to file through VBA and potentially to support your application for VHA.
All right, looks like one last question here in the Q&A tab from Bruce. I applied many years ago and was not accepted. Should I reapply?
Yes.
All right, let me just double check the chat. I think there might be one or two new questions here before we wrap up. We file a joint, this is from Bill Bird. We file a joint tax return. Should I include my only income? I've been denied twice. The income level is very low.
So no, unfortunately, you have to include your spouse's income as well.
Next question from Hill. What about a 20% disability rating? Would I still have to report my income?
No, you don't have to necessarily report it, but if you do report it and it's under the threshold, then you can be exempt from co-pays. But with 20%, you do not have to report it.
And then from Rick Palmer, does investment income count as income?
Yes.
All right, I think that wraps it up. I see one last one here from Ed. Looks like it was just answered. Ed, if you want us to revisit that, just let us know. We can definitely do that for you. Not seeing anything else in the Q&A. Pardon me, there was one that just popped in. Currently, my husband and I, from Lauren, currently my husband and I are under TRICARE. Are there any impacts to coverage if I use VA?
No.
It is kind of unusual when you use TRICARE and VHA. I think that when you schedule your appointment, you actually have to designate whether you want to do it under the TRICARE coverage umbrella or whether you want to do it under VHA. and there are different benefits to each one. And I would recommend, for the sake of time, we can't go through them all right now, but I would recommend speaking to one of our health benefits advisors and talking through some of that. Historically, it's been my experience that VHA is actually more favorable, more advantageous than TRICARE in a lot of circumstances. There may be some where it's not. So you would kind of have to really educate yourself about the benefits of the two. And when you're scheduling, you have to designate at the time of scheduling which one you're wanting to use. It is a little bit confusing.
Okay, I'm not seeing any further questions. We'll pass the microphone back over to our acting executive director, Mr. Dave Collins. Sir.
Hey, thank you, Kevin. Shanae, thank you for jumping in there and answering all these tough questions tonight. And Ken, thank you as well. Appreciate it all. The message here, I hope, is pretty clear. And it's if you served and you're not currently enrolled in VA healthcare, we encourage you to apply and allow us to assist you in determining your eligibility. As previously stated, you can apply online through va.gov/healthcare. You can call VA's Health Enrollment Center at 877-222-8387 or visit us in person at Salisbury, Kernersville, and South Charlotte. And I can tell you right now, as a veteran who gets his care in this system, I think that the easiest and the most beneficial way for you to do this is to just come in person to Salisbury, Kernersville, or South Charlotte. You don't need an appointment, and you can pretty much get an answer one-stop shopping. That's my recommendation. Do with it what you like. You can also use the VA Welcome Kit to learn more about the benefits available to veterans and the VA Health and Benefits app to manage VA healthcare and benefits once connected. If you need local assistance, our VA healthcare system team can be reached at 704-638-9000, extension 13740. You earn benefits through your service. Our responsibility is to make it as easy as possible for you to understand and access them. If you've been thinking about enrolling, make tonight the night you take that first step. On behalf of the entire Salisbury VA healthcare system, thank you for your service. Thank you for spending part of your evening with us. And most importantly, thank you for trusting us with the opportunity to serve you. I pray that you will all have a good evening, and we hope to welcome you to the VA healthcare system soon. You have a great night, guys. Appreciate it. Talk to y'all later.